Hi, my name's Aneem, and this is William, my son.
Hi.
And Sharon Rogliss from Moms That Rocked asked us if we would make this video and share a little bit about our story. And how old are you, Bill?
4.
4, that's right.
I was about to say 4 again.
Oh my. He just turned 4. I had had a fairly smooth, easy pregnancy, and then the delivery again was also, it went quite well. It was fairly smooth. But right away when William was born, we noticed that on his hands and different areas of his body, he was missing large patches of skin. It looked like on the back of his hand, it looked like the skin had been pulled back and was raw. And his toes, when we flipped him over, his toes were all uneven and they were very raw. His feet and just different areas of his body were missing skin. So I had had a natural delivery in a birthing center because I had wanted to do a water birth. And so we got transferred to the first hospital. He was born at night and we were transferred to the first hospital. And then the next morning, I was told to go home that night because there was no one really available to give us any answers or do anything. They were going to wait till the morning. And then early the next morning, I got a call to come in right away because they needed to fly him out to a different city to another hospital. They said that they didn't have the medical facilities to treat him. I went right away to the hospital and they flew both William and I out to the new location. And right away they had called in a specialist to come and to give some advice and suggestions for how to care for him because, as it turned out, William had a really rare condition called epidermolysis bullosa. And they had told me at the first hospital actually what it was called, but they really hadn't given me any information about it. And so as soon as we got into the new hospital, they took William straight to the NICU, to the neonatal intensive care unit, and I had to fill out all the paperwork. And by the time I got into his room, his bed was just swarming with doctors. A few of the doctors came to me and they asked me if I wanted to wait outside, and I was doing my best to stay as calm as I possibly could because I didn't want them to remove me from the room. And so I told them that no, I would like to stay, and they did, which let me stay, which I was super grateful for. So they started explaining to me more about what his condition was, and epidermolysis bullosa is a genetic skin disorder. It's also known as EB. And what it is EB patients are missing a protein in their bodies, and in William's particular type, it's called collagen 7. But what it does is it's what causes the top layer of your skin, the epidermis, to anchor to connect and anchor down to the lower levels of skin, to the dermis. And so without that, those anchoring fibrils, the skin will just shift off and blister with any friction at all. If you can kind of picture it like if you plant a lawn and before the roots have a chance to grow down and anchor into the soil with any friction, it's going to slide right off, and that's exactly how an EB patient's skin is. And it's very similar, the wounds are very similar to a burn victim. And in William's particular kind, because he has one of the more severe types, he doesn't just blister externally but internally as well, anywhere where there is mucous membrane in his body. We had a really incredible group of doctors and nurses and therapists there at the hospital, and they were just wonderful in so many ways. But after together we learned how to care for him because it had been 5 years since they had had an EB patient in that hospital. And so after we learned how to do the wound care and pain management, which is really all the treatment there is right now for EB, we were able to bring William back home, and that's where we've been caring for him since. Often one of the first questions I get after someone meets William and we explain a little more about EB and his condition is there a cure and what's the prognosis? So there is no cure for EB. There is research being done, but as of today there is no cure. And the prognosis is there are a lot of secondary complications caused by EB, from chronic anemia and malnourishment to damage to the eyes because of blistering in the eyes as well. Like in William's case, he does have that problem. And there's corneal abrasions and scarring, which he has as well, and some children will actually lose their eyesight. There's feeding issues because of the blistering and scarring inside the esophagus. The esophagus will constrict and make it really difficult and painful or impossible to feed as a regular person would, and so they'll have to use a G-tube or to bypass the esophagus and feed children directly into their stomach. But then surgery also is pretty complicated, and there are a lot of issues that can come up with that as well. And then scarring can be real disfiguring and cause a lot of deformities. Most EB patients with the type that William has will eventually lose their fingers, their toes. They'll fuse and scar over, web over. And eventually, I think one of the main causes of death is the infection for most EB patients, because their whole immune system, their whole body is compromised, because if you think about it, your skin is your largest organ in your body, and so when you've got those open wounds, you're constantly under threat of invasion from bacteria, and so infections are a real serious concern. And so many children do pass away when they're younger, but if they do get through their teen years, usually by their 20s, most EB patients will contract a real aggressive form of skin cancer called squamous cell carcinoma, which will be fatal because of the repeated damage to the skin. One of the questions that Sharon asked me when she asked me if I would make this video was, what are 3 of the things that my experience with William has taught me in my life? And I would say there have been a lot, of course, and I'm still learning a lot of things. But one would be to not overprotect William and not limit him, and especially not limit him because of my own personal insecurities or fears. And I feel like it's easy to do that with having a handicapped kid, especially, or what people would consider handicapped. But something that is really important to me is I don't want William to grow up with that picture or mentality of himself that he's handicapped or incapable, because I've seen that he's not. And I mean, there may be things that need to be adjusted to make them work for him, and maybe there are certain things that he can't do. Obviously, he's never going to play tackle football or a lot of sports. But there are so many things that he can do, so we really try to focus on those things and not limit him when he wants to try something new, because we're not sure if it will work out, or if even in just social situations too, for me sometimes those are the hardest, that I want to protect him, trying to protect his feelings, because some people are not going to be kind. We've had experiences. We took him to a birthday party where a little boy came up and asked us, oh, is he a zombie, because he sure looks like one. Just hurtful things like that for me are, as a parent, that's the hardest. But I don't want to overprotect William, because in overprotecting him, I'm also keeping him from experiencing life to the fullest, and that's the last thing I want to do with him. I think having William in my life has also definitely helped me to be more grateful for everything, especially just little things, because there's so many things that we take for granted all the time, even just skin. And I appreciate him, like, every day that I have with him. Also, not knowing how long he has here on earth makes me really value every day that I have with him much more. And not just him, that's also spilled over into my other relationships with other people, my loved ones and members of my family. I definitely appreciate all the time that I have with them and know how valuable that is. I think something else that I've been learning with William, and it's not something that I really realized right away, but something that I've throughout the years been realizing, is that it can be easy to especially if you're going through something really difficult, or if you have a handicapped child, I think it's easy to kind of be so focused on your own pain and your own struggles that you kind of can almost feel like you've got it worse than anybody else, or you can tend to minimize other people's pain or the things that they're going through. And something that I've realized and have to remind myself often of is that we do have it so good despite the things that we go through in our struggles. I mean, there's people, we've heard stories of EB families in third world countries who don't have access to medical care or the bandages or facilities that they need. Their clothes will stick into their wounds, and when they take off their shirt, their skin just comes right with it tearing off. And not just with EB, I mean, obviously there's all kinds of issues all over the world and people going through traumatic things. There's that side, but then also just the side of people going through things that don't seem as dramatic outwardly, but it's just as painful or difficult for them in their own life. Like, it's with William, with what he's going through, it's so obvious. It's his skin, you see it right away. It's real, yeah, it's external, so it's easy to see. But I believe that everybody has their struggles and everybody's going through something. It may not be as obvious as what William is or what we're experiencing, but in their life it may be just as painful or difficult for them. And so something that I have to remind myself, and I also want William to grow up realizing, is that other people go through struggles too, even if you can't see it, it's not as visible. It's not, I don't feel like it's healthy or fair to minimize their pain and their difficulties. I've also learned a lot, I would say, about faith and trust. And I think the single thing that has helped me more than anything, and I've had so much help and support in so many different ways from so many people, which I'm very, very grateful for. But definitely my faith has been the thing that has helped me more than anything through all of this experience with William. And just being able to trust that I know that God loves William and he loves me, and that if he allows something into my life, that he is going to use it for good in some way. And not that necessarily the event itself is good, but that there's something to gain through it, some through the experience, even if something to learn, even if it's just greater compassion and understanding for others, which I've definitely seen has happened in my own life with William and everything that we've gone through. It's definitely given me more compassion for others. And to me, that's one of the most valuable things you could ever receive in life.